right, hello, health heads. Welcome and thank you for checking into this dose of the Healthcare Uprising. I'm your producer in the back, Jeremy Carr, here with your host in the front row, Heather Pierce. So, what's on the agenda for today, Heather?
We are talking about women's health again.
Oh,
Surprise.
imagine that.
Yeah, this time maternal health. Also, surprise.
Okay.
We like talking about that. Abigail Bertelsen, she is the CEO and founder of Zenith Health. Zenith Health is, they just launched 6 months ago. Very new company. We love bringing on our early startup founders on the show. But we're going to talk about two big things with Zenith Health, which is their Penny, which is an AI tool for women to basically get all of the evidence-based clinical, informed answers around pregnancy, and also their pregnancy evidence project. So excited to talk a lot more about that with her today. What she's doing, she's really filling a big hole.
Yeah, a lot of really cool stuff going on with Zenith Health here. So, without further ado, let's jump into our conversation with Abigail from Zenith Health.
Hi, and welcome to the Healthcare Uprising podcast. Today, we've got Abigail Bertelsen, founder and CEO from Zenith Health. Welcome to the show, Abigail.
Thank you so much for having me. So excited to be here.
Yeah, great. We are too. So once again, we are continuing our conversation around women's health. We really like women's health on the show. So tell us about your background, what Zenith Health is all about, and kind of how it all came to be.
Absolutely. So Zenith Health is all about bringing pregnancy away from like this game of guesswork and anecdotes and having actual evidence and data to inform our decisions. My background, just a little bit on how I got here. I am a health data nerd by training and background. I was at a company called Datavant prior to founding Zenith. I held a number of different roles there, but it's really where my interest was initially piqued around this idea that we all have data, healthcare data everywhere, and yet so few of us know how and when and where it is being used, as well as the outcomes of that. Meaning, if my data is being used, de-identified in a study, I might never learn that that study was done or what the outcomes were and what that means for me with my, disease state or whatever that might be. And so kind of translating that into pregnancy, maternity care is one of the areas where we have quite literally almost no data, which is unfortunately for a number of kind of structural reasons. Not all of them are nefarious or bad, right? But pregnant women typically aren't included in clinical trials, which is how we generate most of our medical knowledge around things like medications and drugs, which means that for most drugs and medications, we just don't know if they're safe for pregnant people, what the effects are on pregnant people. And so we have these huge gaps for moms that exist today. And so really what we're trying to do with Zenith Health is get rid of those gaps by leveraging all of the real world experiences we already know are happening. There's 4 million pregnancies in this country alone every year. One quick peek through Reddit shows us that, for every mom who chooses to take melatonin despite the lack of evidence, another mom chooses not to take melatonin but still has insomnia. And so that's the kind of experience that we can really be learning from at scale. If we put all of these together, we might finally be able to start learning about whether or not melatonin is safe without, running a randomized clinical trial, which is how we would kind of formally develop that knowledge.
So when you were at Datavant, were you exposed to some of this data? Is that what kind of like initially got you interested in this, or was it just that like how did that happen? Because I'm actually kind of familiar with Datavant. It was my previous job. We actually worked with them. I don't know if I mentioned that to you. Um, and so I understood like how they like operated for us. So kind of curious, like where did that idea, because you're not a mom yet,
Yeah.
or maybe you won't be, but you're clearly invested in it. So
Yeah, I actually haven't, hadn't at Datavant worked explicitly with women's health data or on any projects relating to kind of women's health or pregnancy, which in turn is actually one of the reasons why I got really excited about working on this as I kind of stepped away from Datavant. At Datavant, I worked on a lot of projects with this idea of kind of patient consented data, largely in oncology, where it's very standard to use real world data. And there's tons of projects happening where, patients are sharing their information with what's called a patient registry. So you can say, I have this type of cancer, I consent to share my medical records and kind of contribute that for research and learning on the disease state. As I just personally, as a woman in my 30s, so many of my friends, family, people around me are going through crazy IVF journeys, going through their first pregnancies and having their first babies. And I just kept hearing, largely amongst well-educated, high access to the healthcare system, people that their OB told them one thing, and then their psychiatrist told them the opposite thing, and they had no idea how
Mm.
to make sense of that. And again, the underlying problem here is like we don't actually have data, so everything kind of comes down to who you ask, what their personal risk tolerance is, and kind of what their approach to guidance is.
Mhm.
And so that was kind of my light bulb moment of why are we doing this in every area of healthcare other than women's health and other than in pregnancy, where we actually have so much to gain from even the most basic use of real world data.
Isn't it
We
interesting?
get that a lot around here.
Yeah. I was like, this is like such a common thread, and and not to say it's cool that that information wasn't there, but I think it's kind of neat sometimes when you're looking at something, like in healthcare and you're not looking at the thing that you're solving for, but you realize there's a problem when you don't see it like represented, right? And you're like, oh, wait a second, where's that information?
Well, it's
And
also fun when you feel like it's actually a solvable problem. Like there's not,
totally.
10 leap, oh, if only this data existed somewhere and someone had ever taken melatonin, then we would be able to structure all this. It's like we know that it's out there. We know that it's happening. So it
Yeah.
feels very, achievable in a sense.
Yeah.
And there's so many things that go with pregnancy that they don't know about. I mean, your possibilities are endless here if you really want to get into it, right? It just starts
Complete.
with melatonin. I mean, there's a million things just like that. How does this affect pregnancy? How does this affect pregnancy?
Even even the most basic things, like we get a lot of questions, for example, about, is it normal to gain this amount of weight by this week? Like we don't have answers to those types of questions. People, as they're creating, birth plans and thinking about how they want to deliver their baby, what are the pros and cons of, this type of induction method versus a natural birth versus, what about a home birth versus a hospital birth? And there's just so many questions, and it can be really, really hard to get a straight answer
And
Yeah.
on
and
all of
today,
them.
where do we go? As I call it, Dr. Google, right? Or the Reddit hole
Right.
and
It's turning into Chat GPT now.
or chat, right? ChatGPT is like now the thing. So
Which
that's where
isn't the best idea for.
no, not necessarily. And so where do you get where do you get real legitimate answers to these questions versus some rando on a Reddit thread who had a completely different experience than you because pregnancy is such a unique experience. So like Zenith Health is really trying to fill that gap, right? It's like you're like serving up evidence-based information, clinical information that's gathered from multiple places, reliable like clinical resources and like putting it into this little magic AI tool or like tell us about that exactly. Like how does that all work?
Yeah, exactly. So Zenith is actually kind of two parts. I'll start with the part you just described, which is what we call our Penny tool. Penny is a nickname for your pregnancy evidence navigator. And Penny basically is an AI-enabled tool where you can ask any of your pregnancy questions. So skip Dr. Google, and come straight to Penny. What happens on the back end, for those who are curious, is let's just run with the melatonin example for a minute. Let's say your question is, can I take melatonin while I'm pregnant? It's the middle of the night. You're standing in front of the medicine cabinet. What do I do? Penny will basically, there's two steps. So I always like to call out that it's not, chat GPT style, let's do generative AI and write a poem about melatonin. We first search against kind of our ranked list of approved sources. So we categorize things into peer-reviewed research papers, medical and kind of academic guidelines, things like the American College of Obstetrics and Gynecology when they have clinical guidelines on certain questions. And then the AI element is really in kind of summarizing and collating everything from those sources. And so you'll get back an answer that says, essentially, here's what we know about melatonin use during pregnancy. Here's what we don't know. And here's kind of what's being currently studied or some of the key data points as you're making this decision. And, we've tried to keep this, it sounds kind of funny to say like, oh, we have a Q&A tool that doesn't give answers. But we really are aiming to be kind of a neutral third party that says, here is the evidence, here is the information. There is not really ever a right answer. And so our goal isn't to tell you what to do, it's to kind of equip you to make that decision with the best available data and kind of democratize that out of, your doctor's hands or open evidence or wherever the kind of truth sits today.
Okay. So that's Penny,
That's
which,
Penny.
by the way,
Where do we find Penny?
where?
Yeah,
Yes, you can
where?
find Penny right on our website. You can also, we have a snazzy askpenny.mom URL. And so you
Oh,
can
there
just
you
type
go.
that right
Oh,
in and get straight to Penny. We
okay.
also have
And
an app that just launched as well, if you want to
oh,
check
You
it
can
out
do
in the App
okay.
dot
Store.
mom now? Is that a thing? You can do
All
dot
sorts
mom?
of domain extensions
That's
are now
cool.
available. So
Because the .com and the
the dot coms are
.org.
gone. There's no
Yeah,
more.
exactly.
Yeah, yeah.
I like that though, the more creative. Okay, so that makes it more memorable, quite honestly.
Yeah,
Okay, so we'll make sure we put that in the show notes. But so Penny's free, right?
Penny is free.
Wow. It's just a
Nice.
free tool. That's really amazing. Somebody can just go right on your website, get reliable, clinical resource, right, driven answers versus, I mean,
Yeah, like much better than a random chat GPT
no
thing that's going to tell you it's
shit,
true
Trin.
whether it knows it or not.
I
Right. And
like,
that's something that we've been pretty like manic about in our product experience
yeah.
is every sentence pretty much in the response has a citation that you can click into and then go see the source. So again, whether that's a research paper that's being hosted on PubMed, whether that's an ACOG guideline that you can click into directly, because we really want people to feel like they're able to, we are very credible and reliable in what we're providing. But if people feel like they want to fact check it, if people want to dig deeper into a source, like that is fully kind of within our product experience as well. You'll never be wondering, like, I wonder where they got this from.
That's great. That could be super educational for people as well.
Very. I mean, God, I'm remembering when I was pregnant back in 08, 09, and then again like 2013. It was like, this is the size of your baby. It's an avocado. Here's a chart. Like that's like all I had.
We
Like
still
it
have
was,
that. That's
yeah, we do. But like that was it. Like here's a
yeah,
pamphlet. It's amazing how far we have come. Thank you, technology. Thank you, AI, and apps. And I want to ask you about the app too. But I want to ask you potentially a controversial question.
love
Uh-oh.
it.
Here we go.
She's like, love it. All right,
I
let's
love
do this.
controversy.
So sorry, I totally did not prep you for this, but like it's happening. So you're talking about evidence-based information. Recently, our RFK Jr., who
Hmm.
talked about the Tylenol and the pregnancy and the autism and the whole thing, all of the medical organizations that have existed for decades, these are clinical experts. These are the people that kind of define how providers perform in their facilities to treat their patients, and they're saying no. How are you handling that with Penny and the other parts of your website? Because that's a big problem. A lot of pregnant women are kind of freaked out right now. What do I
A
do? Is
hundred,
this safe?
100%. This is where I'll give maybe a kind of controversial answer. Again, this kind of goes back to like, we are trying to be the most neutral, like fact-driven thing that you can find to answer this. So the real problem on Tylenol is exactly why the company was founded, which is despite the fact that it's been basically considered the safest option we have in pregnancy for forever, because we actually know that ibuprofen is riskier. Lots of other kind of pain management solutions are riskier. There isn't really like a perfect study or like perfect data that actually shows this. It's kind of the lack of that data that, the lack of adverse events that have shown us this. And so there's been a bunch of studies that have been done using different methods, but really the fundamental problem is that we don't have a large scale definitive data set. And that lack of clarity and that lack of like proof in a sense is what allows these detours from kind of clinical practice and widely accepted guidelines to actually catch fire. Because if that type of statement was made and there were 10 large studies with perfect methods that said actually no, it's safe, then it wouldn't really be a question. But that's not the world that we live in. And so we're constantly in this kind of era of how do we make the best decisions we have with the data that we have available, knowing that it's not perfect. And so again, Penny will basically surface today. We saw that question come in probably 250 times on,
That was
September,
going to be my
whatever.
next question. How
Yeah,
many people have
Yeah.
actually asked this question? Because I have to
a
imagine
lot.
anyone that knows about Zenith, and is using your tool, that'd be one of the
Yeah.
first questions I would put in there as a
Yeah.
pregnant mom.
All the time. We
Yeah.
get that question quite a lot.
Mm.
And so basically, what we do is we summarize here are the studies that have been done. Right now, the best available evidence, which, by the way, is basically this large study that was done off of Swedish data that looks at about 2.5 million kids born to moms. I won't get into it here unless it's exciting. I think it's kind of cool. But Sweden basically has this national birth register because they have a nationalized healthcare system. So they actually do have a data set that is very large scale, that is over a long period of time. And so they can kind of look at these things.
There you go.
And what they did in that study is they basically control for siblings. So if there's two children to the same mom, in one pregnancy, she had a Tylenol exposure, and the other pregnancy, she didn't. That's actually what they're comparing to see, was it the Tylenol or was it genetics or, familiar, like other kind of confounding factors that might be leading us to see this association between Tylenol and autism rates in children. A lot of the studies that have been done previously didn't appropriately or adequately kind of account for those potential confounding factors, which is why there are a lot of studies today that say, oh, yep, there is, this link between autism and Tylenol exposure during pregnancy. So all this is to say, Penny will kind of surface, here's the controversy that exists in the research. Here are the studies underlying it. The best clinical guidelines today, which are largely viewed to be through ACOG, who has repeatedly said that Tylenol is still the first line of treatment for these types of
Mhm.
things, is kind of the safest, best option. And so we don't really make a judgment call on Tylenol is safe or not, but we say, here's what all the studies said. Here's why they are conflicting. Here is, kind of what the general consensus from the highest quality physicians and experts is today.
Okay.
See, and that's the kind of answer you want. You don't want somebody going, I have the whole truth right here. You have somebody going, well, this says this, and this says this, and this says this. Let's add it all up.
Yeah.
You know what I mean? Like that's how you actually research something. It almost sounds like it's more of a teaching thing than anything, really.
I mean, it's kind of funny. We talk a lot about like our internal marketing and social campaigns, and half the time we're like, what are we really trying to say? Half the time it comes out to like critically think about this, like,
Yeah, that's
consider what's
exactly
out
what, yeah,
there. It has nothing to
Critical
do with
thinking.
pregnancy, it has nothing to do with health. It's like, okay, evaluate the claim. Is it
yeah.
from a reputable source? Were they using reputable methods? Like, do you trust this person? And
Right.
so a lot of it is actually
It,
kind of meant to be this educational, empowering type of tool. We really want to
Yeah.
give people like a toolkit, not just an answer.
Hmm.
right.
And not just somebody's opinion.
Yeah, this
Right.
stuff that doesn't have quick answers. There's a lot to it. So you gotta, but a lot, everyone knows that people want quick answers. So a lot of places are just like, hey, just give them a quick answer.
Mhm.
I like that you guys aren't doing that, that you're actually putting together the real, the existing evidences and comparing things. And yeah, that's great.
Well, and then you have something, pretty reputable, right? Pretty solid that you could then take to your OB, or your midwife or whoever it is that's supporting you through pregnancy, and you can always, run it past them. And they might have it, they might come back and say, well, because of your specific condition or whatever, right? Like they would be able to potentially come back and say, you might need to modify, or this might not be totally accurate for you. So the role of the provider is still extremely important.
100%. Yeah. And we actually have been partnering with a number of providers and largely doulas, actually, that moms are
Mm.
working with to support their
God, they
birth.
keep
The
coming up.
rise of the doula. Gosh,
They're
we
Yes,
cover
the
everywhere.
rise of
doulas
the
on the show.
doula. We need more.
I love it. This is the uprising.
We've done like 3 episodes on it.
I know.
Really?
We've
That's
covered,
amazing.
yes. Well, we cover women's health so much. It keeps coming up, and I freaking love it. So bring
Yeah.
it on.
Yeah, but doulas really share kind of our ethos on just being this kind of empowering advocate for moms and being that
Yeah.
like sounding board, helping them think through their decisions and plans. So they've loved Penny as well, in terms of like exactly what you just described, whether it's, getting an answer from a mom saying, hey, here's what I found. Like, do you think I should do this? Or using it themselves to answer a question that they've never seen or heard before, from a mom that on the other side is like, oh my gosh, my symptoms went away. What do I do? It's like you get the 5 a.m. text like, like now you as the doula are going down kind of the
Right.
the panic Google trying to find a reputable source. So it's
That's
been great.
awesome. So you've got Penny, and then you've got there's the pregnancy evidence project, right? There's that,
Mhm.
and What was that the other thing we needed to talk about? Sorry, I am
Yes.
like, we had two big things. I want to make sure I was calling them the right thing. So
Yes, I got so
cool.
totally sidetracked on
I did too.
and
I was
autism that I got too excited about it.
Uh,
sorry.
it's quite the,
Um,
yeah.
We
but
do that here.
I love it. The
Yeah.
Pregnancy Evidence Project is ideally the type of thing that can kind of help settle these debates once and for all. This is really like kind of the founding ethos of the company, which is what would it take to answer some of these questions with more certainty and not just give an answer that says the research isn't conclusive. We don't really know. There are all these risks, there are all these potential benefits, make your own decision. But how do we actually say the research has shown these risks occur this percent of the time in these types of, scenarios? And so the Pregnancy Evidence Project is really what we hope to be that kind of largest scale maternal health patient registry where moms can opt in. So there's a lot of talk about this right now, like in the women's health space and specifically the reproductive health space around how my data that I might put into Aura or Flow or some of these other apps is actually like used and, kind of extracted. The Pregnancy Evidence Project is a fully kind of contained, fully IRB governed research project that sits within Zenith. And so you can ask Penny as many questions as you want. None of that data is used for the Pregnancy Evidence Project. But if you so choose, you can kind of go through the consent and enrollment flow to sign up and share your pregnancy experience and your clinical information so that hopefully we can kind of amass this giant patient generated data set that includes, exposures, symptoms, quality of life, experiential data from pregnancy that we then tie together with clinical outcomes for mom and baby so that we can actually start to answer this. The question behind melatonin isn't can I take it or not? It's if I take it, will there be some terrible outcome for my baby or myself that I don't know about? And so hopefully by taking basically what's already happening in the real world and having moms report their experience, and then tying it to what happened to them and their baby, we can start to develop this outcomes type data that can really help inform Penny, obviously, but more broadly, the state
Mhm.
of medical research in pregnancy going forward.
Right. Which apparently doesn't exist. So
Not in
you're
this
building it.
country anyway, apparently.
Well, I wanted to say too, when you were talking about this study in Sweden, and they have the data because they have a national health system. I wanted to interrupt, but I didn't, with saying, and this is why a national health system could be a benefit, right? Because of things like that, because it gives us data. Because don't we all want to be better? Don't we want our offspring and like, I think about it, like, I want the world to be a better place for my kids and my grandchildren and my great grandchildren, you know?
Totally.
Why wouldn't we want that? So
Totally.
No.
anyway, I won't go down that hole too far. So pregnancy, I'm looking at your website too. So that's like an opt-in sort of thing, right? Like, so if I know about Zenith I'm telling my friend and I'm saying, not that any of my friends are pregnant, but I do have some cousins. My cousin's kids, like that's my life now, is that we celebrate more 50th birthdays than babies being born. But like I could tell them, say, hey, you should go to the Zenith website, opt in to like share your information. That's one way to do it, right? Or somebody that's already using Penny. But what
Mhm.
about through actual like OBs, midwives, doulas? Like, do they know about it so they can say, hey, patient or client, you have this opportunity to share your experience and clinical data. Is that happening?
At a small scale, that's happening right now. That's actually something that we're currently spending quite a lot of time internally investing in figuring out the right way to kind of partner at larger scale. I
Mhm.
didn't mention at the beginning of the call, we did just launch in May, so about 6 months ago. So we've been very focused initially on kind of the consumer experience and how Penny is serving moms and how moms are finding out about us. But as I alluded to, we've been starting to partner with actually quite a number of doulas as well as doula training and credentialing organizations so that, when a new doula walks out into the world, how do they have Zenith in their toolkit, both for Penny, but also to refer folks into the project? Because we found that folks who enroll are likely coming through some trusted person, right? Like it's
Mhm.
a big ask for someone to, stumble upon our website from a social post and then say, yeah, sure, I'll share, all of my deepest information with you. I know nothing about this, but seems interesting.
Right.
And so we've seen really high rates with doulas and midwives and other types of perinatal care providers when they kind of refer folks in. And so we've been kind of thinking through the best way to expand uh, to OB offices and kind of delivery centers and different places where moms are already getting that interaction from their providers.
You must know Latham Thomas. Yeah,
Yeah,
she was the first doula we had on. She was back in
She's
episodes 10 and
amazing.
11.
she is. Yeah, we did a double header episode with her because our conversation just kept going.
Yeah.
It
She's
was so
amazing.
good. Yeah.
Um, these other countries that have these national data sets, do they share that with anybody or do they just keep that for themselves?
That's a great question. So a lot of the researchers can use the data sets for different things from different countries. I don't know candidly about like whether, there's broad cross border sharing happening of the like data sets themselves for other types of purposes. But it is really interesting. Like Sweden in particular, there have been just a number of studies on, there was another one about opioid exposure for like pain management in a hospital for pregnant moms and the risk of neurodevelopmental disorders in their children. That was published off of the same kind of data set. And so it's certainly very powerful when we do have it.
Yeah. That'd be a great thing if everybody started sharing all that.
Yeah.
I mean, think of all the data, all the countries in Europe that have socialized medicine that if they're all keeping records like that and they share it, I mean, as once you were able to decipher it all, you could start really figuring some stuff out, probably.
Yeah.
And even within the US, Canada, we all love to say, oh, we can't do anything right in this country in healthcare. There are some really amazing pockets of great data sets, but they're just siloed, or, their registries being run out of academic medical centers. So if you don't live within driving distance of Mass General Hospital and you're not going to go deliver your baby there, you're probably not going to be included in that data set. And so my
Mm-hmm.
point of view is always like, more is better. Like this isn't a
Mm-hmm.
zero
Yeah.
sum thing where someone's going to like win women's health data and everyone needs to be off building their silos in the corner. I really think that if we can figure out how to kind of connect all of these great kind of niche data sources that already exist, we're well on our way.
Yeah. Got to stop making it a competition, make
Yeah.
it a cooperation.
Like in population health data is really important. Even from my time where I worked on the payer side or insurance carrier, whatever word you want to use. Um, we were always looking at population health data, and sometimes you looked at it from a regional perspective because that mattered for like an employer for or a Medicaid plan, or because it's only in a certain number of counties. But then you have to expand out to look at it from that 36,000-foot level to see where those trends are, right? Like maybe something is happening in the southeast region of the country around pregnancy and birth that we're not seeing in the Northeast and things of that
Right.
nature. And so having access to that data is like really important.
Totally. And it would be amazing to see. I mean, we have some high level kind of outcomes data around this, but I'll just share kind of a heartbreaking stat, which is that about half of the counties in the United States do not have a single practicing obstetrician in them. So just think of the implications of that if you're a pregnant person living in one of those counties trying to go get appropriate prenatal care or deliver your baby. That means you're driving like 30, 50, 100 miles. I was talking to someone recently who was sharing kind of a story from a hospital in rural Georgia.
Hmm.
And they were saying that so many of the moms that come in to deliver there, they are seeing for the first time when they show up to deliver their baby. So if you
So
come
they've
in
had
at
Wow.
no prenatal
They've
care.
had almost no prenatal care. If you show up at, 36 weeks, they say you're not leaving because like we have you here now. So like
Mm.
you're here until you deliver your baby, which is just totally like crazy. I will actually plug this company. You guys should chat with them if you haven't, but it's a company called Pomelo Care who's really focused on doing a lot
They're on
of
my list.
yeah, they're
Yeah,
amazing. I like am a huge fangirl of
I
what
know who
they've
they are.
built.
Oh, yeah, they're pretty cool. Yep.
But
Hmm.
they're kind of trying to pull into this like telehealth intervention so that people who can't get in-person doula or midwifery or OB care throughout the course of their pregnancy like have somewhere to go to know what they
Yeah.
should do or what to be worried about before they're having that like final in-person interaction at the hospital.
Oh, yeah. The rural healthcare issue and these maternal healthcare deserts. I mean, it's a real thing. People that live in cities and urban areas have no idea. Like, you just don't think about it, right? Like, it's
Right.
not, it's outside of your bubble. But, here, like, we live in Flagstaff. We have a hospital. We have, I think, two OB offices. We have a couple of birth centers. The rise of the midwife, the rise of the doula has become really important. And we border Navajo reservation, and it is like desert from here to New Mexico. And that's what, two counties, Jeremy?
Oh yeah, the counties in Arizona are huge.
And all they have is Tuba City, and there's one office
Right.
covering the whole, if you've looked at Arizona, it's like the whole northeast corner of the Arizona, one office
Yeah.
in Tuba City. Hours drive. I mean, it's many of them come here. Yeah, it's not great.
Flagstaff has the only real hospital in all of northern Arizona.
That's a huge,
Wow.
huge area.
The only real hospital north of Phoenix in
Hmm.
Arizona is Flagstaff. It's the only one.
Yeah. Yep.
If you have a medical emergency on the Navajo reservation at the Grand Canyon, Kingman, I mean Kingman, they might send you to
I
Vegas.
think you probably go to Vegas. Yeah.
Yeah.
But even still, that's,
There's no hospitals here.
yeah.
Like there, we have clinics. There's a
Hmm.
lot of urgent cares,
Hmm.
but that's just in Flagstaff too. I don't know if they even have that
Yeah.
in other places, really.
Yeah. It's a problem. Yeah. So telehealth, plugging in these doulas and midwives wherever you can, particularly in rural areas, that's a game. I can't imagine not showing up until 36 weeks. So many things could be going wrong. And then all of a sudden it's a bit, and then you're in the hospital for weeks. That's
Right.
extremely expensive.
Totally. Well, exactly. And that's kind of Pomelo's model is how do we take out the like it's just a giant cost driver for payers and they work with a lot of Medicaid um, groups. But I think it is just goes to show again, so many of these things can be caught with like education and just awareness. Think about like the early signs of preeclampsia, gestational diabetes, and getting the proper testing for that. These are things that are like driving really, really awful outcomes for mom and baby that are totally catchable and like manageable if you're
Hmm.
able to kind of get that care and if you're able to not be, dismissed because yeah, everyone's feet swell in pregnancy is probably nothing. Turns out, 2 weeks later, oh my gosh, you have gestational hypertension. You need to go to the hospital immediately. Like there's just all of these things that, I think getting better information into the hands of moms so that they can better advocate for themselves and hopefully have structural advocates again, like, partners or doulas or midwives or a really strong OB. But
Yeah.
just a lot of
So,
fun.
yeah, sorry, went on like a total tirade there, but I've worked in this industry for so long, and so much of like half, I don't know, 10, 12 years, I worked in Medicaid, where, average 50% of births in any state are they are born under Medicaid plans. And so yeah, I've learned so much about it. It's a really big problem. So I don't want to keep beating that dead horse, but well, it's not a dead horse. It's a topic and a thing we need to talk more about. But for the purpose of this conversation, I want to hear about your app. And you also just went through a rebrand, which looks really
Yes.
spectacular, by the way. I love
Thank
it.
you.
My marketing brain absolutely loves it. I've been looking at your website, but tell us about the app. Is this with Penny? Is this with the pregnancy evidence project? Is it
Cool.
all the things?
Yes. So right now the app is primarily focused on Penny, although there is kind of a tab where you can go to start contributing. It will take you back to our browser-based contribute platform, soon to be in the app as well. But yes, the app is really designed. We heard from so many people. I want to ask Penny, once you ask Penny your questions, you kind of get accustomed to the type of information and format and everything. And it's been great. And so people have been asking, I want this in my pocket. I want this like one tap away. And so on our app, you can now download it. You can ask any of your questions to Penny. And then there's also what we think is really kind of fun. And we've seen a lot of people start to use is kind of a home screen. One of our goals is to help people feel more prepared in advance of having the like midnight panic spiral. And so there's a whole kind of home screen where you can see different kind of common questions by gestational age. So, what are you thinking about in the first trimester? What often comes up in the second trimester? By topic, whether you're kind of concerned or interested in, nutrition and diet or exercise or, pain relief or different kind of topics where you can see other common questions and get an answer to your questions as well. So we've seen that be really successful with our early launch.
Nice.
Awesome. Very, very cool. Did you have a question, Jeremy?
No.
Oh, okay. I didn't want to cut you off. Um, I keep thinking about this too. And one of the other things I want to say this for moms, new moms, first time moms. Um, and I've had two kids. Um, don't think that you're going to have all of your answers after your first pregnancy because your second one's going to be totally different. And just like your children, right? Like it's like raising different humans. I thought I had it figured out, right? And then I was like, oh no, this kid's totally different. He's like his father. Um, but same thing. Like I could see where something like Penny is, it's not a one and done for for a pregnancy. Like you go back to it, it's going to give you and not, you know, to leave out the important fact that you're constantly gathering information,
Right.
and the more information that's being fed into Penny, the smarter and probably more useful it becomes over time. So yeah.
Totally. We actually get a lot of questions kind of along those lines from second time moms that are of the format, X happened in my first pregnancy. Y is happening. Is something going wrong? Like, is this bad? Is this a cause for concern, or is this just kind of normal variation between pregnancies? So we definitely see like the first time moms have kind of certain flavors of questions, but moms with like second, third, fourth children have a lot of questions like that. Like, is this different fine, different not fine? What should I really
Yeah.
be worried about?
Yeah.
And I didn't actually mention before too, but we also support postpartum, largely focused not on, I think there's a lot of groups out there that are focused on, my baby is or isn't doing X. Is that bad? What can I do? But really focused on mom's health. You kind of go for your 6 week postpartum visit and they're like, great, you're cleared, good to go. And you're
Good
like,
luck.
hang on, but all of these insane things are still happening with my body. Am I supposed to like
Uh-huh.
really just like go back to work? Is this normal? And so we support a lot of questions from moms who are newly postpartum as well, around a lot of the changes that happen in mom's body.
Oh, good. We
Does,
love that.
does it make the science more difficult that it is so variable, like not only from woman to woman, but pregnancy to pregnancy for individual women? Does that make it harder to actually find solid answers, or is it still just a matter of gathering enough data and you can figure it out?
It's largely a data scale problem. Practically speaking, nobody is really at that scale yet, so it does make it a lot more challenging. And a lot of the findings have to be kind of more generalizable. Because really, in a lot of these things, it's like you want to kind of narrow down or at least account for things like demographic differences. I talked about weight gain, like what was your starting BMI? What was your starting weight? How tall are you? All of these different things that to come up with meaningful answers, you really need to kind of account for, which ultimately is just a problem solved by scale of data.
Okay.
Awesome. Yeah, I even think about like my own pregnancies, like how different they were. I ate my way through my first one. I was so I was so overweight after that one. My second one, I was like running 4 weeks later. I was like, because I worked out almost all the way up until I gave birth, and I was like, I think I ran the Pat Tillman race down in Tempe like 3 months after I gave birth, and it was like the fastest mile run I ever did. Meanwhile, with Zane, I was like, I'm like, give me more sweets. It's
Hmm.
so wild. Yeah. Anyway, sorry. I like being able to throw my stories in these conversations.
The
I
real
love it.
question, when you get deep enough into the data and you have enough of it, will you be able to decipher the future character and like
Ooh.
personality of the child based on the effect the pregnancy has on the mother? What kind of child are you about to have based on the cravings you're having and things like that?
Isn't that the million dollar question? They
Yeah, that would
actually,
be
so
crazy.
there's quite a lot of like old wives type tales about this kind of stuff. Like, oh, if you
Oh
have a
yeah.
lot of heartburn, it means your baby's gonna have more hair. Like, if you're craving sweet
Ugh.
things, it means you're having a girl, like, versus a boy. And there have actually been some studies done, like, on retrospective data to try and get at some of these things. The answer are basically that they're somewhat inconclusive. And
Sure.
especially with things like gender, it's kind of a coin flip. But
You'd have
um,
to really get some data. Like,
Yeah.
I can only imagine the data set you'd have to put together to really start figuring that out.
yeah,
Yeah, or like where is the baby sitting? Like high or low,
yeah,
like
exactly.
indicates.
Yeah.
Yeah. Oh well. Well,
Well,
maybe
you get a few tens of millions of pregnant moms to send all their data, and you can might be able to start figuring stuff like that out.
yeah, true. So with Zenith, obviously you're doing something that no one's ever done before. I imagine there's a lot of interest in this. Um, and this is pretty new, right? I mean, you said you launched 6 months ago. So you're like early stages, but like what's like do you have like a big dream, like this ideal state to get to, or like where I don't know, where do you keep going from here?
Yeah, I mean, I think there's a couple things. My practical answer to this when people ask me is I am currently don't have any children of my own, but my goal is like by the time I am pregnant, we've answered at least one of these common pregnancy questions such that I can have a solid evidence base. And really the kind of macro thing that I would say is um, one of the anecdotes that I like to share is when we were kind of pre-launch and doing a lot of research before actually building this product and starting the company, I was obviously talking to every pregnant person that I know and every person with children that I know and kind of asking about their experience and trying to really kind of shape what we were building. And one really sticks with me, which is a friend had gotten access to her own medical records following her pregnancy because she needed them for some other thing, but basically saw this note from during her pregnancy from, a physician note that was written into the record. And it said, patient called and asked if she could take Robitussin. She claims to have a cough, denies fever. These are all verbatim words that were used in the note, which is a whole separate problem. But I advised her or recommended that she inhale steam from the shower and drink hot water with lemon. And I just don't know where we kind of lost this idea that because someone is pregnant means that they do not deserve like a high standard of care and quality of life. And that anecdote really like sticks with me. It's not just about, okay, can we have, research to answer these questions? It's about how do we like bring pregnancy care on the same level that most other forms of care are in. If someone is going through chemotherapy and has cancer and they say, I'm so nauseous, I'm like throwing up all the time from the chemo, we don't tell them, well, that's cancer, good luck.
Yeah,
We,
suffer, right? I mean,
like,
that's
like
what
too
it
bad,
is.
right? And
Yeah,
that's what it
it's
is.
like,
There's these
sorry.
hyperemesis gravidarum in pregnancy is
Oh,
a condition where you're
my best
vomiting
friend had it. Oh, it's
like
awful.
10 to
What's it
15
called
times
again?
a day. Hyperemesis gravidarum. You oftentimes lose weight. You literally can't eat. It is literally a debilitating condition
Become
and
hospitalized. Yeah,
become
Wow.
my
hospitalized.
best friend
Like
was in the hospital three
it's
times.
it's horrific. And we basically were
Mhm.
like, well, that could happen. Like,
Right.
which is just crazy. And so really like I think with all of this, so much of our ethos as a company and like what I really hope to see happen is not just like getting the research for research's sake, but bringing this into a world where we can study pregnancy, like we can advance, the field. Just because research and trials are hard in pregnancy doesn't mean we should just throw up our hands and say, well, guess we can't study it. Like, guess we can never, improve on what we know now. So that's really kind of my macro vision for where I hope all of this goes. And again, all of this I think largely applies to other areas of women's health as well,
Mhm.
where it's like so many women's health conditions take way too long to get diagnosed. Women are questioned and told, yeah, that's probably fine for conditions that end up being really serious, just because there's not kind of good knowledge or research or, biomarkers or tests for some of these things. And so I think there's a lot that we're doing here in pregnancy that can also hopefully expand to other areas of women's health as we start to build out this type of model.
Yeah. Yeah,
Hmm.
it's not, and you're right. It's kind of like, oh, well, you're pregnant, so you just have to suffer. Like, deal with it and get through it, you know? And why? That doesn't make sense. Although I will say, even like pre-ACA, okay, guys, everyone listening, if you want to know one of the best benefits of the ACA for those who are trashing it, it was that I became pregnant and my husband and I were both self-employed. I was a pre-existing condition and I was therefore uninsurable. And I'm like, are you friggin' kidding me? Yeah, I had to pay cash, like for everything. ACA changed that, by the way, ladies and gentlemen.
Yeah, the whole pre-existing condition thing was nonsense. They could call any, like, they literally had free reign to just be like, no, you already had that.
Yeah, good luck. Good luck with that. Yeah,
We're
like
not going to cover anything that was going on already before this
okay.
new policy started.
Anyway, that my little ACA plug there. But to be called a pre-existing condition was like
Well, I mean, because you could
insulting.
have insurance, right? And then you get pregnant. And then when your insurance is renewing, they could say, oh no, you have a pre-existing condition. We're not going to insure you anymore, right?
Right, and pregnancy was one of
Yeah.
them.
So like in the midst of it, like you have insurance and
Yeah.
then you get pregnant, they could just be like, yeah, you don't have insurance anymore.
Ugh, it was madness.
Right? And they could do that for a lot of things.
And then you have the problems during pregnancy and they're like, "Oh, suck it up." It's
Right. Good
like
luck.
you can't
Yeah.
win. Like
Yeah. So
being
even if you are covered, they're not doing anything for you.
like it's not easy to be pregnant in America, and unfortunately, and our
Yeah.
the maternal death rates in this country are staggeringly high for a first world
Yeah.
country. So,
It's bad enough that they don't know, but the worst part is they don't seem to care.
mm,
Because the fact they know the research hasn't been done, they don't care to do it.
yeah. Well, that's why we have Abigail and Zenith to do
Yeah.
it.
Yeah. Like we need these people to come out who actually realize that this needs to be done.
Yeah.
Yeah.
That's crazy. Like the whole medical world has just ignored this for literally forever.
Yeah. Well,
One other thing
thanks for
that's
stepping
really,
up.
yeah, I mean, it's been so, exciting to build in this space and just hear so many people who are excited about what we're building, moms, doctors, doulas. So it's been really great to see kind of the reception. But one other thing that I will just mention is I was at a panel a couple weeks ago, and there was this incredible midwife who was speaking, who does a lot of advocacy and policy work. And Heather, to the stat that you just shared, like we have an abysmal maternal mortality rate as, a first world country. And she kind of got up on this panel and they asked, the nice magic wand question at the end, what's one thing that you wish was different about maternal health care in this country? And she said, can we stop measuring success based on whether or not mom died? And it was very, very,
Wow.
um, it was kind of a humbling moment because everyone in the room kind of looked around and she continued on to say, that is our only benchmark right now. That is like what we're all working towards. I bet if we asked everyone in this room who is actively working on maternal health, who is actively working on these problems from a healthcare perspective, from a policy perspective, we would all have different answers in terms of like what we're aiming for, in terms of what good actually looks like. And, as a healthcare community, we all really need to align on that, beyond just mom doesn't die during childbirth, to be able to make progress in this area. And so I've been sharing that quite a lot because it really stuck with me. And I think it's so true. While the maternal mortality rate is abysmal and we need to fix that, it's like not the only thing that we
Mhm.
really should be aiming for. And, I constantly want to, ask everyone who's working on this, like, what are we aiming for? What does good look like? What does good look like from 12 months before you actually think about trying to conceive through, your kid is 5? What does that actually look like for mom's health and how do we define good?
Yeah.
That's a great question.
Hmm.
I'm
Thought
glad
provoking.
somebody's
I
out
like
there
to
asking
share.
it. Yeah, that's a great question.
No, it's an important question because I mean, and there's these statements and comments being made like, why is the birth rate going down in this country? I mean, there's a lot of reasons why. It's like we want to be taken seriously as mothers. We want to have reliable information, especially as this next generation comes up that they are dependent on and reliant on and expecting the information to be given to them is to be like legit. Like I want to be able to go on an app like Zenith. I want to be able to get this information. You can't give me that in 2025, like, right?
And it's a big affordability thing too,
And the affordability thing too. Also that.
which
But
is the other side of the coin.
yeah, that's another podcast that we don't have.
Yeah.
I'm sure we could find a way to weave it
Well,
in.
we
But
talk about the affordability side of healthcare in some other
we do.
episodes. So yeah, it's in there.
But
It's in here.
there's a lot of reasons why, but there's also a lot of ways that we can fix it. You're a part of the solution. I love that you're doing something I wish I had. I think I say this to every single person that comes on the show now. But at least we're building something for the next generation or current parents now, new moms, new dads too, for that
Yeah,
matter.
and finally, just the fact you're finally gathering the data, like the fact that nobody's even bothered to do that yet
Until now.
until now, it's crazy. It's a great step forward. Yeah.
Yeah. Yeah. Bravo. I'm
Thank
excited
you.
for you. I can't wait to see what happens.
So I do need your links for the show notes though.
Yeah, tell us
So
what
it's askpenny.mom and
yeah, give us all the
Yes.
info. How does
Ask
somebody find you?
askpenny.mom is how you can get to Penny most directly. Our website is zenithhealth.io, to our prior conversation about all the .coms being taken.
Yep.
And then you can search for us in the App Store under Zenith Health, and we should pop up and you can download our iOS app, soon also coming to Android, but not quite yet.
Okay. And you can also use Penny on the website as well, right?
Correct. Yeah, any
Okay.
web browser, desktop, mobile, in your pocket, wherever you are.
awesome.
Awesome. And are you on social media too?
Yes,
Can we
we are
follow you out there?
we are on Instagram and TikTok at
Great.
the Zenith Health. All one word.
Say it again. V.
The Zenith Health.
Oh, the Zenith. Okay,
Yes.
gotcha.
Oh,
Sorry.
Zenith Health.
Perfect.
I gotcha.
Make
Awesome.
sure to follow you out there.
All those will be in the show notes.
Excellent. Well, we've covered a lot today. This is really exciting. I'm so glad that Zenith is here and doing the work that you're doing. We need it badly. So bravo and cheers to the next stages of success for you. Obviously, launching an app is a big deal. So
Great step forward, and giving people that instant kind of access can be very helpful too. Just getting users on board.
yeah.
Good stuff.
Zenith should be part of the new mom toolkit.
Yes, hopefully it is becoming part of the new mom toolkit across the country. But
I hope
thank
so.
you guys. This was so much fun. I always love to get to talk about what we're working on with other healthcare enthusiasts and advocates and curious minds. So it's been a lot of fun.
Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube and Patreon, patreon.com/healthcareuprising, if you want to watch us in action.
You can also find us on social media on LinkedIn, Blue Sky, Instagram, and Facebook. Just search Healthcare Uprising to find us. And if you're a new company or a creator with a cool new product for the healthcare space, or if you're someone with a personal healthcare journey and you'd like to share it with us here at the Uprising, please email us at healthcareuprising@gmail.com, and we'll get back to you about coming on the show. That's all for this dose of Healthcare Uprising. Till the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
This has been a Shut Up production.
Shut up!